Bariatric surgery. So oftentimes when I bring up bariatric surgery, it's a bit of a shock to a person. And the reason I feel comfortable talking about bariatric surgery is one, that I know it's a real useful tool and treatment for real chronic progressive and relapsing disease. The other is that for people that fulfill criteria, not everybody likes that word, for bariatric surgery, that we know in general people enjoy better quality of life, longer life, less complications from obesity than those that have gone through best medical and lifestyle management. So bariatric surgery is approved in Nova Scotia for people with a body mass index over 40 or greater than 35 with a complication like type 2 diabetes. And the way I think about it is that this, again, is your tool to understand and consider. And it isn't up to me what's right for you as an individual. So I hope that I can provide some education around bariatric surgery so you know what that tool is, why it's being considered, what's its risks and potential benefits. And so I hope that this is helpful. So in Nova Scotia right now, the main surgery that we do is called a vertical sleeve gastrectomy. And that's a laparoscopic procedure. It takes about 45 minutes to do. It's done in Halifax. They remove around 80% of the stomach laparoscopically. And the way it works is it reduces certain hormones like ghrelin, and it increases other hormones, a whole host of them, one of them being GLP-1 agonists. GLP-1s, which are that hormone that the drug company has figured out reduces body weight. So the intestine is this long, enormous endocrine gland that's producing all kinds of hormones. And when you have vertical sleeve gastrectomy, nutrients get into that intestine faster. There's enhanced or increased hormones that are sent out and speak to the deep brain to tell the brain that it can be satisfied at a lower caloric intake. So with effective bariatric surgery, a person doesn't have to restrain from eating extra calories. They're just naturally more full and more satisfied. So that's the theory around it. Some might say, oh, that sounds extreme. To which I ask often, what would you think about getting your gallbladder removed for, say, a stone? And many have had their gallbladder removed and have experienced some of the benefit, but there can be complications from having your gallbladder removed, being diarrhea or stomach upset, or some complications from having surgery itself. Well, bariatric surgery is not a lot different. Similar complication rate to having a gallbladder removed, but a whole lot of benefit. Reduction in risk from arthritis or sleep apnea, fatty liver, type 2 diabetes, heart disease, improved and enhanced quality of life. That means more meaning in life and longer life. So for those that fulfill that criteria, it's very useful and effective treatment. It's a perfect treatment for the chronic disease of obesity. It's and that's the nature of it. So I kind of think that you have this condition and you have an effective treatment. Often because of the bias and stigma about obesity being a choice or a personal responsibility, you have a misunderstanding of the role of bariatric surgery. So bariatric surgery is simply an effective treatment. And it's for you to consider. And there are risks to it. There's bleeding risk or infection. You do have to go through an implementation process of meeting a dietitian, learning about a protocol. There's a period of a diet of all liquid diet for a week or two. Not easy. I've lasted 2 days, but many of my patients do it just fine. Speaks to that motivation and will that's there, which it's incredible. And then a low-calorie diet up to the time of surgery. And some caveats there. I often recommend eating a healthy pattern of eating. At the lowest calorie, one can still enjoy life. So weight loss should not be a prerequisite to getting bariatric surgery. We know that people after surgery have the same effective weight loss, whether they lost weight before surgery or after. So if you choose to go through bariatric surgery, I'd recommend a link to the Halifax Obesity Network, as well as a link to an interview with Dr. Ellesmere and I going through some of the details. And I'd just say there's other options for bariatric surgery other than the sleeve gastrectomy that include a Roux-en-Y or a duodenal switch. I won't talk about those today. Just a little bit more, say bariatric surgery is decided upon at this time, the wait list is about 1 to 2 years. So there's lots of time to think and contemplate and learn and prepare. You can always, if you decide to go forward, you opt out to say it's not the right thing later on. And after surgery, you need a fair bit of time for recovery. So at least a couple weeks physically and up to a month, likely just to get resettled into your life, experiencing life after surgery, and continue to follow a good, healthy way of eating. And you do need to be on a liquid diet for a period of time. So this was a longer video, but it was an important one, in my opinion, on bariatric surgery. And we'll talk more.